Welcome to week 2. You successfully made it through the first week of class. Congratulations. When I'm actually recording this, I haven't. Most of you haven't submitted your discussions yet, so I can't really comment too much about them and how the week went. But if you're watching this in week 2, you made it so far. So good job. I thought what I would do as we now, really launch into maybe what you might typically think of as topics for lifestyle medicine, or what perhaps you maybe signed up for this class for. It probably would be a good idea for me to give you a little bit of context on why this class is set up the way it is. So what we will do in this week 2, in module 2, is we'll talk about lifestyle medicine topics that are, behavior change, exercise, nutrition, sleep, stress, alcohol, tobacco, those typical lifestyle behavior activities that have shown to prevent and treat and mitigate chronic disease. So, but we're only going to cover it in 1 week, right? So just to give you some perspective, this course, or a course name titled Lifestyle Medicine, is offered in our undergraduate program that we call Healthy Lifestyle Management. That's the major that we have. And so in HLM 450, the class is called Lifestyle Medicine. So of course then for the graduate program, it's Advanced Lifestyle Medicine. So why is that? I mean, that's really the point of what I'm trying to get at. Why is this class advanced compared to our undergrad? Well, the undergrad, we take our time going through that book that you'll start reading here in module 2, and we work through that book nearly the entire semester, and we supplemented with some other information, but we nearly spend the entire semester going through that book, and we'll go through each chapter week by week. It's written specifically. That book was written, I wrote it specifically for the number of weeks that we typically have in a face-to-face semester, so that we could roll through the book like that. So that's, lifestyle medicine. It gives an overview. It ties together lifestyle activities with chronic diseases and specific chronic diseases and their application. But in the grad program, of course, we want to cover that, but we want to go beyond that. And this is where the first week gave us a heads up for that. Really thinking about our healthcare system, the factors that determine health, what social justice looks like relative to lifestyle medicine. And so those are topics that are important for us to really get an understanding of how lifestyle medicine can be effective to treat and to prevent and to mitigate chronic diseases. So a little more to the story. I was thinking of a Paul Harvey reference, but maybe some of you are not, are too young to. So the rest of the story, Paul Harvey was a great radio show. Anyway, I used to listen to it when I was a kid with my parents. So I digress, right? Got off track in a hurry. This program, so back in, let me think, so we're in 2020 right now. Back in 2007, we started a program for our employees at Creighton University that was intended to mitigate their risk for chronic diseases, and specifically cardiovascular disease. We were finding that, so Creighton is a self-insured organization, which means whenever someone has, for instance, a heart attack, yes, we have an insurance provider that processes the claims, but the money to pay for the heart attack and the care and so forth came right out of our savings account at Creighton. So many companies are self-insured, and so it makes sense for them to have programs that keep their employees healthy because it saves them money. So our claims back in the middle 2000s, the highest number of claims on the medical side were cardiovascular related, on the drug side were cardiovascular related. And so what we wanted to do was put together a program that was beyond health promotion. Okay, so we have and had health promotion programs at Creighton for many, many years, where we promote healthy eating and exercise and stress reduction and so forth. But what we didn't have was an advanced program that took people who are already at risk and tried to decrease that risk. And so that was the point of this program that we started back in 2007. It was called, terrible name by the way, it was called the Cardiovascular and Diabetes Risk Reduction Program. And like I said, it's a terrible name, but it said exactly what we were going to do. And the people who were in charge of the money to pay for it, meaning like human resources, they understood that, right? And so they understood the metrics that we needed to show in order to show that our program was actually being effective. So the Cardiovascular and Diabetes Risk Reduction Program took and takes employees who have either outright cardiovascular disease, but mostly people who have risk factors for them. High blood pressure, high cholesterol, diabetes, obesity are the big ones that we focus on in that program. So we ran that program for about 10 years, and we found out that we were doing a significant amount of goodness, I guess, by way of improving people's quality of life and improving the bottom line for Creighton. So we had independent people come in and evaluate our return on investment, and we'll talk probably more about this as you go through the program. There is way more to talk about, of course, than I have time for today. But anyway, so long story short, the program was successful then and still remains successful today, although we've renamed it to be the Lifestyle Medicine Clinic at Creighton University. We have hired someone to run it specifically. Back in the good old days, 2007, it was just me and my backpack going around and meeting people wherever they wanted to, where it would be effective for them to have a one-on-one time with them. And my backpack, the reason I bring it up, it was really full of lifestyle medicine tools that helped behavior modifications. And so what we found out after a year is that, people who are in the program, just to give you a little bit of heads up for this, they didn't pay anything to be in it. It was completely voluntary. They could be in it as long as they wanted to be in the program. And they received, of course, educational material, home blood pressure monitor. Back in those days, we used a pedometer to count their steps. Home blood pressure cuff. Did I mention that? Home blood pressure monitor, and other, I guess, tools that aren't coming to mind at the moment. But they got a lot of stuff to help them monitor their health and so forth, journals and whatnot. But the biggest piece was we also paid for the medication. So any medications that they were on to manage their blood pressure, cholesterol, and diabetes, Creighton paid for 100%. And not just they paid for them, we filled them at our own pharmacy at the hospital, and we delivered them to their office. So as you can imagine, some people were on and are on, because this program still continues, 12, 15 medications, and Creighton picked up the tab for those and continues to do so. So they were paying for a pharmacist's salary to do it, and all of that is pretty expensive stuff. So you could imagine, Creighton was pretty interested in saying if they could justify the cost for this. So what we found out, to make a long story short, is after a year, our return on investment was 4-to-1. So every dollar that Creighton was spending on the program, they were saving 4. And mostly that was cost savings by not having to use the healthcare system. People, of course, were on less medication by that time, by a year out. But also, people were taking the medication as they were supposed to, so it was more effective. They weren't seeing their physicians as much. They weren't using the emergency room, for instance, for like diabetes emergencies and so forth. And so as we continued to roll through that, at 5 years, our return on investment jumped to 9-to-1. And if you know anything about chronic disease management programs, that's really an unheard of number. And in fact, I really don't say that a whole lot in public because nobody believes me anyway. So So I usually stick to the 4-to-1, and that's across the board, that I just say our internal investment is 4-to-1, and that's impressive enough. 9-to-1 is our actual number at 5 years out, and that's because we were able to establish a relationship with the people who were in the program. We saw them once a month. They were required to see us once a month. And we developed this relationship, this coach-client relationship, if you will. And in fact, I called the position an ambulantist rather than a health coach, because it was something that I felt like made sense at the time, that I wanted to keep the people ambulatory, or in other words, out of the hospital. So the ambulantists, we had 4 of them at the time, seeing people in the program, and it was effective. So okay, let's fast forward, and there's more data to the story that I could talk about, but we won't today. We'll bring that in at some other point. But we thought, okay, this would be a really cool thing to replicate somewhere else. What would be great is if we could wrap an academic model around all of the methods that we developed over this 5 to 10 year time period that we know are effective in behavior change and that can save organizations money. So that was why we developed a master's program in what we were doing. Initially, we called it a master's program in health and wellness coaching. And at the time, we felt like health and wellness coaching was such a new thing that this was going to be the right name for it. It turned out it wasn't the right name, and so we have since changed it to Integrative Health and Wellness, because it more broadly describes what we do, and then to have a concentration in health and wellness coaching. So the reason I tell you this, the backstory is that's where the program was designed. It was completely designed in a backwards way from the way most academic programs. We implemented a program, we modified it and remodified it and remodified it year after year with developing tools and so forth that we felt like would help in behavior modification. We had the data to show that the program was effective, and so then we said, okay, took a step back. What are we actually doing? And let's break it down into pieces to see what we're actually doing in this program and why it might be effective. That's how we built the courses for the Integrative Health and Wellness program. So of course, it made sense to start off by talking about lifestyle medicine as broadly as lifestyle medicine can be, before we then dive down into specific other courses like health behavior modification and exercise for chronic disease and nutrition for chronic disease and stress and sleep management and so forth. So that's where this course started. And it's good, I feel like, in the program anyway. So I feel like it's a good information for you to know, because sometimes you take a program or a course and you just don't understand the context behind it, and so I felt like it's a good idea to let you know what that's all about. So this course becomes advanced because we look well beyond understanding that knowing that exercise is going to help manage blood pressure. Okay, we've known that for decades, right? And so we can learn that on an introductory level, of course, and that's what you're going to be doing in this first part of there's a book that you start reading in this module 2. But we need to get beyond that, because what we found out in the early days of the risk reduction program was that my worst enemy was the doorknob. I always like to tell students that. I mean, I could sit in front of people and it was just a one-on-one conversation, and I could help motivate them. I could teach them on what works and what strategies might work to help manage their body weight or their cholesterol or diabetes or so forth. But then once they hit the doorknob on the way out, then it's up to the mercy of society. And we know that the influences of society are so strong, and that's why we started with what are the factors that determine people's health, and should not be a surprise that it's society, that it's culture, and that these, when we go to the grocery store to try to be successful, it's nearly impossible because of all of the marketing that we've heard, the way the store is laid out, and what we're influenced to buy while we're in there. So we know there's a lot more to it than just saying to someone, if you want to manage your body weight, you should better, and want to lose weight, just eat less and exercise more. I mean, hopefully we're not giving only that advice anymore. That's the olden days when we didn't quite understand all the influences, and so we need to get to another level with this, and there are so many more levels to go that this class can't reach them all, but at least we're getting started. So this week 2 and week 3 get through that first book on lifestyle medicine for chronic disease, gives us the nuts and bolts, gives us the references to look at what the guidelines are, so we can understand how all the pieces fit together for lifestyle medicine. But we can't stop there. So we need to then go further into the telomere effect, and so we can understand, okay, maybe from a biological standpoint of what this means, but we need to launch way beyond that. So we can't stop at the telomere effect and just knowing that, and that's where we really take off. What I hope we can, at least in this class, is understanding why people behave the way they do, and understanding disease process that's beyond biomedical reductionism. And you'll get to that, I think, in that Chronically American book that you'll read later. But biomedical reductionism essentially is saying, okay, I understand that people will perhaps get type 2 diabetes because they don't eat right and aren't active enough. And so there's a lot of steps that happen physiologically, where you go through, insulin resistance and high blood glucose and so forth. So we can track back all this biology to make it make sense, but that still doesn't help us in the end with the person who's sitting in front of us, helping them to eat better and move more and sit less. That's where the advanced part comes in. That's where the art of all of this comes in. So anyway, that's where we're getting to in this course, and then if you keep rolling through in the program, by the end, hopefully you'll have this idea of how you have a person in front of you who is very much like you, and also very unique in their own way, but that you can develop and build a relationship with, to help them get to where they want to be. Okay, so I always tend to go way longer. We're already at 17 minutes in this, and there's 2 other things that I wanted to mention on this. Okay, so hopefully this won't get too long. The discussions, I usually wait till week 2 to talk about your discussion boards. One of the things that I'm challenging you, encouraging you to move yourself towards, and the ones that I've read so far in week 1 are are really well done. So a thoughtful reflection about what you read and what it means to you. But then the discussion questions is really where I want to, give you the challenge for today. And not limiting yourself to asking your classmates and your colleagues, what do you think about XYZ? Okay, that's an okay question, but we want to get deeper. We want to start asking the big questions. The questions that can actually do something to change other people, not just about what's your opinion about. Okay, that's good, and it helps with the discussions. That's largely an undergraduate level of thinking. We're gonna bring ourselves to a graduate level of thinking and start asking questions like, why? Why is the healthcare system the way it is? Why is prevention in the healthcare system not emphasized? Why, when I go to the doctor, does he or she not talk to me about lifestyle medicine behaviors? Okay, how can we do something different going forward? How can a nurse who's practicing lifestyle medicine make a difference for patients who have diabetes? So those are the how and the why type questions that can get us to another level, to get to the big question, right? I mean, I'm challenging you to get to the big question. What is the issue we're dealing with here? Okay, so when we're talking about chronic disease in America and it being so prevalent related to other countries of the world, certainly the West is a mess with lifestyle, with chronic disease and so forth. Relative to how much we spend in this country, why is that the case? Why do we spend so much on healthcare, and then our outcomes are so poor compared to other countries? So those are big questions. And can they be answered in this class? Not likely, but we need to start a discussion, right? We need to start thinking in that direction instead of just saying, well, I understand it on the peripheral level, and then I'll just move forward and just tell people they need to exercise and eat right, and then I'll feel good about my job. That's not where we're headed. Okay, hopefully that's not where you're thinking, that where you stop at that point. If all you're doing is saying to someone, eat better and exercise and sleep more and stress less, and that it ends there, you're not doing anyone any type of service in that way. We need to understand this at a deeper level. Okay, so that's where I hope the discussions kind of get to in that way. The two other things I wanted to bring up: you have an assignment due at the end of week 2. It's a survey project, and this is where you're gonna, when you sit down with somebody, and hopefully what okay, but let me back up. That we don't, hopefully when we sit down with people, we don't make assumptions about what they're thinking, about what their experiences have. We want to find out from them how they feel about what healthy means. Okay, so you read about what the factors are that determine health. Really important. I'll keep bringing it up as we go forward, because that sets a foundation for all of what we do. When we're meeting with someone one-on-one, they have preconceived notions of what health means and what they feel like will make them more healthy. Okay, what I'm asking you to do on this assignment is go out and actually ask people and see how it relates to what you read. We're actually going to do it just starting into data compilation, right? So you have to ask quantitative and qualitative questions, and then aggregate those and report those back, and then see what your thoughts are relative to how they compare to what you know, or at least have read about for the factors that determine health. So that's the purpose of that. The other thing is get started on your week 3 assignment, which is going to take you a couple weeks to do, actually. So that's why it's in there, to get started on it. You'll have to, in blue line, you'll have to go into module 3, into the self-care project, and start looking at those, the assignment as it's laid out in there. So in week 2, go ahead and enter into week 3 and look at that assignment and get started on that. There's an explanatory document there on how to do the self-care project. And the reasoning behind this project is, we're going to ask people to use this type of journal, or to fill out this type of document to track their eating, perhaps, or to track their physical activity, or to track their blood pressure, or think about how they feel before and after they're eating, or monitor their sleep. All kinds of tools that you can use in lifestyle medicine to help modify behavior. But we need to try them on ourselves first, so we know how it feels. And that's the purpose of this, is you become your own first patient in this self-care project. So you're going to use these tools, all the tools that are in the book, the chronic disease, the Lifestyle Medicine for Chronic Disease book. You're going to use those tools on yourself. Then you're going to write up a program, and then you're going to test the waters in that program, at least for a short time. We only have a couple weeks to do all of this. So the data gathering is going to take you several days to do data gathering, and then you write a program for yourself, and then you start to implement the program. There's also a reflection paper that you'll write that goes along with this at the end of module 3 as well. So there's a lot to do there. So I want you to give you a heads up, so you look at that and get started on that in this week of week 2. Okay, that's enough talking for the day. 25 minutes, jeepers, you'd think I was in a classroom. So anyway, if you have any questions, as usual, let me know. Good luck. Can't wait to read your stuff coming in. Thanks.